We'll say for the purpose of this video that you've cleared the prior authorization process to have this procedure performed. You must bring the support hose with you when we do the procedure. These are specific to you and will be done as a prescription. Actually, the prescription, without trying to be proprietary and with no personal interest in Morton Pharmacy at Mercy Oakwood handles the support hose prescription we'll be giving you today. Most other people have a hard time finding the stockings if they don't go there. We need you to bring those support hose in when we do the procedure because those are the ones that already fit you. You will then come to our office with a reasonably empty stomach. The reason we want you to have a reasonably empty stomach is we want to give you some medicine that will sedate you, and we're going to give it to you by mouth. If you come here with a full stomach and we give you medicine by mouth and it sits in food, you will not be sedated for this procedure. If you have significant narcotic issues, meaning we will be giving you a narcotic pill, it's the only pill of narcotic that we will give you for this procedure is an hour before the procedure. But if your stomach is very sensitive to that, we won't give you that. We'd give you an alternative medicine for prevention of pain through the procedure. You will come here then the day of the procedure and our ultrasound tech will do a mapping procedure. Sue, our ultrasound tech, will spend about a half an hour doing the mapping. She'll show us by drawing on your outer skin where the vein is. And we can find it with the ultrasound, but we like to have it traced out on your skin on the outside to determine where we are going to close the vessel. And we close the vessel from the groin down to as far as we can get the catheter to comfortably fit. This catheter is about the size of a Bic pen lead or the inside of a Bic pen. And so it doesn't fit in all veins, but it fits in almost all varicose or larger veins. We will then take you to our procedure room where under this local anesthesia, oral anesthesia by the pain pill in a Valium and an antibiotic taken orally, we will then do the vein closure procedure. The vein closure takes about a half an hour to do. We first put a needle into the vein and then put the catheter up through a needle. We then numb all the way around the vein the whole length of the leg. That involves 4 or 5 needle sticks. And that's really the hardest part of this whole procedure is a couple of needle sticks to numb the area where we will then put actually a larger needle through to further numb all the way around your vein. We numb all the way around the vein, but people don't describe that as pain. They just feel pressure around the vein. And it's usually, it's done under ultrasound guidance, done so that people really don't complain about that being painful at all. We then do the vein closure, and that involves turning on a device which heats up the wire that's inside of that vein. Now, it doesn't heat the whole vein at the same time. It heats a section that's about 2 inches long for 20 seconds. And then we back the catheter out by 2 inches every 20 seconds and heat the vein and basically close it by shrink wrapping it from the inside as we pull the catheter out.